Okay, so good morning everyone. So today we are going to learn about how to do a general physical examination and centered around how to continue the general physical examination towards a systemic examination of musculoskeletal system. That is to say how to look, feel and move any joints. So this is my patient. He presented to me with complaints of pain around his elbows since last 6 months. So before doing that, I would like to proceed with a general physical examination. So whenever a patient comes to you with any complaint of any system, never directly jump into that system. Always start with general physical examination. So general physical examination starts with something called A, B, C, D, E. A means appearance, B means build, C means consciousness, D means decubitors, and E means exposure. Okay? But before doing that, always take consent from the patient. So मोहम्मद जाफिर तपाईको चाहिँ जाँच गर्नुपर्ने हुन्छ है। तपाईले समस्या लिएर आउनु भएको छ। यो समस्याको लागि चाहिँ मैले जाँच गर्दाखेरि तपाईको आँखा, तपाईको शरीर, तपाईको खुट्टालाई छोएर हेर्नुपर्ने हुन्छ है त। यो जाँच गर्नलाई तपाईले केही किसिमको आपत्ति छ? छैन है। तपाई अहिले एक्लै हुनुहुन्छ है। यो जाँच गर्ने बेलामा तपाईले तपाईको छेउमा कोही भइदिए हुन्छ? तपाईलाई त्यस्तो चाहिएको छ अहिले? छैन है। So always ask for a chaperone. So if he had been someone of opposite sex, it would have been a compulsion. Okay? Okay, so because he said that he does not need any chaperone, I will continue with my examination. So on appearance, he looks a well-looking man. He is not visibly in pain. Built, he appears moderately built. I am just judging this by the look of his body. I am not sure about whether he is moderately built or he is obese. To make it sure, I would like to check his BMI. For that, I will need to assess his height as well as to know his weight. So when I know his weight and assess his height, then I will be knowing about his body mass index, okay, BMI. But even without knowing BMI, I can judge that he is moderately built. He is not visibly obese or malnourished. So he is moderately built in his build. On consciousness, since I asked him about some questions, since I already have talked with him, I know that he is conscious and he is cooperative. Now the one thing that I need to know is whether he is well oriented to time, place or person not. Okay? So Mohammed Zafir, how many family members are there in your family?
Six.
So 6 family members. Can you name them?
मेरो बुवा मध्य ग्रामीण भाइ, मेरो भाइ इस्तेरा भाइ, मेरो बहिनी अमृता, मेरो हजुरबा अनि मेरो अङ्कल.
Okay. So what time of day is it outside?
बिहानको 10 देखि 12 बजे हो.
Okay. So he is well oriented to time and he is also well oriented to person. So whether he is well oriented to place or not, you can ask him is तपाईले कहाँ हुनुहुन्छ?
म कलेजमै छु.
अहिले तपाईँ उहाँ कलेजमा हुनुहुन्छ. So he is well oriented to time, place as well as person. Okay. So when I look at him, he is lying, sitting comfortably. He has no any particular decubitus of size. He is sitting comfortably. Okay. Exposure means whether he is exposed to any kind of IV catheters or whether he is exposed to some kind of IV cannula or Foley's catheter. Since he presented to me in OPD, he doesn't have any of those exposures. Okay. So after ABCDE, what I will do is I will look, I will try to gauge his health from a general physical examination from head to toe. Okay. For that, first of all, start from pelor. Okay. So Zafir Mathi, so when he is looking upward, I am looking towards his palpebral conjunctiva, which appears red. So it is not pale. Show me your tongue. So for tongue, I would ask him to show me his dorsum of the tongue or upper part of the tongue, not the lower part, upper part, please. Okay. So in dorsum of the tongue, it does not appear pale, so it does not appear pallor. Besides that, I will also check his hand and compare his hand with my own hand. Since both of them are equally red, I will assume that since I do not have anemia, I don't have pallor, he also does not have pallor. Besides that, I will turn around, I will check for the redness of his nail bed as well. Besides that, I would also like to check for his palms as well as soles and general body surface, which does not appear abnormally pale. Right? Okay. So after that, I will check for the icterus. For icterus, I will ask him to look downward. So look downward, please, and I am looking towards his scleral upper bulbar sclera, which does not appear abnormally yellow. So he does not have the icterus. In oral cavity, I will look towards the under surface of the tongue. तपाईको जिब्रोको तल भाग देखाउनुस्. Yeah, something like this. So it does not appear abnormally yellow. Once again, so for icterus as well, I will check his palms as well as soles. I will need to ask him to remove his shoes at some point, but for demonstration purpose, I will not do today. So I will examine his palms as well as sole as well as his general body surface, including his abdomen as well. Sometimes don't forget to examine the abdomen for general body surface as well. So there is no icterus. Okay. Then L for lymphadenopathy. So for checking lymphadenopathy, I will have to get behind him at some point. Okay. So please sit here. So for lymphadenopathy, especially the cervical lymphadenopathy, I will get behind him in this fashion, and I will try to expose his neck. So I will ask him to open up his collar. Okay. So now his neck is adequately exposed. I will have to check the cervical lymphadenopathy. There are first transverse chain and then there are vertical chain. For transverse chain, use both of the hand at once. So first, slightly under flexion, try to palpate the submental group of lymph nodes. So this is submental, so he does not have any tenderness. He has no any abnormal facial expression showing that he has tenderness. Then I will check for his submandibular lymph nodes. So I cannot feel any lymph node, and he does not have any tenderness as well. So submental, submandibular. So this is the jugular-digastric. Check both of them at once. Jugular-digastric. He does not have any visible pain. And then continue to preauricular. So this is the preauricular group of lymph node. If he had any type of infection in his external ear canal, then this group of lymph nodes would have been swollen. Then continue this with posterior group of lymph nodes. Okay, just behind the ear, these are the posterior group of lymph nodes, and finally the occipital group of lymph nodes. Sometimes some patient can have infection on his scalp. In these conditions, what can happen is the occipital group of lymph nodes can get swollen. Especially the pediatric population, the children can have occipital group of lymphadenopathy because of some kind of scalp infection, usually tinea infection or lice infection. Okay. So this was all about the horizontal chain. Now I will continue with the vertical chain. So for vertical chain, although use both your hands at once, but do not try to palpate at once. Use one hand to maneuver his head. Okay. So in order to make the skin slightly lax and the muscle slightly lax, I will try to move his head towards the same side that I am examining. Okay. So on doing so, now I can examine the vertical chains. There are two vertical chains, the anterior and the posterior. The anterior lies anterior to the sternocleidomastoid. So upper anterior, middle anterior, and lower anterior. In the same way, lower posterior, middle posterior, upper posterior. Okay. And then once again I will go to another side. So upper anterior, middle anterior, lower anterior, lower posterior, middle posterior, and upper posterior. So he does not have any cervical lymph node. Finally, you cannot miss supraclavicular type of lymph nodes, which are also called Wernicke's node. In doing so, I will ask him to raise his shoulders. Try to raise your shoulders like this, so that the supraclavicular hollowing is created, and then I would like to palpate. Ideally, I must palpate beneath his clothes. Okay? Yeah, so there is no any supraclavicular lymph node. Okay? Finally, for sciences, please once again sit here. So finally, for sciences, once again, I would like to check on his eyes. For demonstration purpose, I am showing you once again. But when I was examining his pallor, I had already examined his sciences. Okay? So once again, look at his eyes, so your tongue. Look at the lateral margin of the lips. These are not yellow at all. I will look at his fingers and palms and soles. These are not bluish at all. So there is no any sinuses. Okay. Then finally edema. As I already told you, edema is checked in the most dependent part of the body. So adequate exposure is a must. And always start checking edema from around 2 cm above the medial malleus. So these are the medial malleus. Always be symmetrical. Use both of your hands at once and press on the bony prominence. Do not press somewhere around here because there is a massage and it will give you a depression even if there is no edema at all. So always press on the 2 cm above the medial malleus on the shin bone. So I will press for at least 10 seconds, and after 10 seconds I remove my finger and I notice that there is no any edema. Had I noticed edema, I would have extended upward and I would have tried to find the uppermost part of the edema. So by finding the uppermost extension of edema, you can also find out the severity of its illness. Okay. Finally, note whether the edema is pitting or non-pitting, or is it tender or not tender. Okay. Then check for clubbing. For clubbing, there are 3 methods. One is to know the lower bone angle. Lower bone angle is the angle between the nail and the skin, nail and the nail bed. Okay. So if normally the lower bone angle should be less than 180 degree. Okay. His lower bone angle is also less than 180 degree. Check in every fingers. Okay. And check in both of his hand. Okay. So lower bone angle is less than 180 degrees, so he does not have clubbing. Besides that, you would also like to check for something called Samuel's window. You will notice a diamond-shaped window between the two fingers, between the nail and the nail bed of the two fingers, and this obliteration of this diamond shaped sandwich window is an indication that the person has clubbing. Okay, so besides that, finally what you can do is you can also check for something called fluctuation. For fluctuation, you would want to know whether his nail is fluctuating on the nail bed or not. Okay, so for that what you need to do is you need to stabilize this finger by the middle finger of your two hands. So I am stabilizing this using my middle finger. Finally, I will stabilize the distal part by using my thumb. So these two fingers are used only to stabilize his finger. And finally, to assess whether there is fluctuation or not, I will use my index finger. Okay, so I will press from one side and feel from another side. I will press from this side, feel from right side. I will press from right side, feel from left side. And I will notice that his nail is not floating on the nail bed. It is firmly attached. So there is fluctuation test is negative. So he does not have clubbing. Okay. So finally, I will also look for dehydration. Okay, I will also look for dehydration. For dehydration, I will ask him to show me his tongue, which does not appear abnormally dry. And then I will also look for something called skin pinch test. Usually students, what they do is they do skin pinch test on the dorsum of the hand, but it may be falsely positive, because the signs of aging appears first in the peripheries, in the hands and the foot. That's why ideally always you must do a skin pinch test on the abdomen, but do not pull something like this. Do not pull horizontally, pull vertically, because abdominal folds are also arranged horizontally. So always take a fold of abdomen, pull and then leave it. And I am noticing that his skin goes back within 3 seconds, so he does not have any dehydration. Okay, so this is